For almost 11 months now, Israel's armed forces have been laying waste to Gaza. Their war with Hamas fighters leaving over 40,000 Palestinians dead. But now a new potential killer is stalking these refugee camps. The polio virus, detected in sewage water and spreading fast for the first time in 25 years. And this is its first victim. Baby Abdurrahman is sleeping through the sound of an Israeli drone overhead, gently fanned by his mother in their tent. He was born just a month before the war began, and moving from shelter to shelter to escape the fighting meant he was never vaccinated. Suddenly he stopped walking and crawling. His paralysis, the first recorded case of polio in the Gaza Strip.
I was shocked that my son got this disease in these conditions. I don't know what to do. They told me they can't do anything for him other than giving him pain relief and calcium drops. I don't know if it will help him.
The family lives in this neighbourhood. Imagine the challenge of giving polio vaccinations when fewer than half of Gaza's clinics and hospitals are working. Though it may help that hundreds of thousands of refugees are packed into small areas after obeying Israeli evacuation orders, though that also gives the virus the opportunity it needs to spread. The plan to reach 640,000 children over 9 days, followed by a booster in a month's time.
Extensive exposure to virus, the transmission we think is all across Gaza. It's widespread and it's intense. So it's going to take a very rigorous effort to vaccinate all children and stop this outbreak and prevent its spread.
Israel and Hamas have agreed to pauses in the fighting from Sunday, though Israeli officials insist this is not the first step to a ceasefire. On Tuesday, this World Food Programme car was fired upon by their troops near a checkpoint. The Israelis said it was a mistake, but at the UN Security Council, the rolling out of a polio vaccine is making diplomats nervous.
These security incidents make the work of these organizations significantly harder. These incidents should not happen. Israel must not only take ownership for its mistakes, but also take concrete actions to ensure the IDF does not fire on UN personnel again.
This morning, children were among those injured and killed in an Israeli airstrike, close to where the polio outbreak was first detected. The UN reckons 14,000 children have been killed in this war. Now the challenge of a mass vaccination campaign for those born into a world which now looks like this.
Well, I've been speaking to Hareen De Silva, a British doctor from the medical aid charity UK Med, who's in Gaza and involved in the vaccination campaign. I began by asking how it will work and how urgent it is.
It's very urgent. So since 1988, worldwide cases of polio have decreased since over 99%, and in the Gaza Strip, it's been polio-free for 25 years. So even one case can be detrimental. And again, children are disproportionately affected here. So we're really concerned about children under the age of 5 getting it, because 1 in 200 cases go on to develop acute flaccid paralysis, which could be permanent, and about 5 to 15% of any case could be fatal with paralysis of the breathing muscles.
What are the chances of being able to vaccinate over 600,000 children in such a short time?
It's going to be very difficult. So WHO is coordinated to try and get 1.2 million vaccines in, because we're trying to vaccinate 640,000 next week and repeat the dose again in 4 weeks' time. It will be a huge coordinated effort between the local health authorities here, the WHO, as well as international organisations and other UN agencies. But we can only hope and try and aim for the 95% vaccine coverage we need to make sure that this doesn't spread and we get another case of, unfortunately, a 10-month-old who's become permanently paralysed.
I mean, given hospitals have been bombed, convoys of displaced people have been bombed, and a medical supply vehicle have been bombed as well. I mean, how high are confidence levels going to be for people to come and get their vaccines?
we're confident that the surrounding communities will be able to come. We're sending out our community engagement teams to talk to our local communities to try and get any child under the age of 10 to come in for the vaccine next week. We are based in the humanitarian zone, the UK Med hospitals, but there are points outside of the humanitarian zones which will be doing vaccinations as well.
And how would you describe the current situation?
For the primary healthcare centre which I manage, it's just, unfortunately, we're seeing a lot of respiratory infections and skin diseases, which is it's much attributed to the water, sanitation, hygiene issues with water, toileting facilities destroyed, etc., and as well as the close proximity of tents and people living together. So scabies is one thing that we've seen often, and impetigo, which is easily managed in the UK. You see it in nurseries with just simple antibiotic cream, which is very difficult to get here into the country at the moment. So all of the simple things that we take for granted back into UK are just exponentially made worse here just because of supply chain issues and poor sanitation situation here.
And how would you describe the security of medical workers at the moment?
So it's very difficult. So a few weeks ago, the UK Med guest house where we stayed at was unfortunately hit by shelling, and we had to evacuate that house. And now all of us international staff members and the national staff that were with us protecting, and the guards are staying with us at the Type 2 field hospital. So we can only do what we can. Our areas are deconflicted and people know where we and the forces know where we are. So it's just a matter of just following all the procedures that are set out for us, and just local security policies and following them to the best of our ability.
Harim De Silva, thank you very much.
Thank you very much.